Well, more kids are ending up in the hospital with COVID-19. In fact, here in St. Louis, health leaders say there are now 25 kids in the hospital with COVID-19. At last check, 7 of them are in the ICU. The age of people in the hospital is younger, doctors say, because they are less likely to be vaccinated.
And of course, many families still can't even vaccinate their young children, even if they wanted to. Abby Larico with our vaccine team joins us with the latest on when that could happen and what's being done.
Well, beginning this weekend, the Biden administration has announced a push to get young people vaccinated, urging doctors to talk about COVID-19 shots at back-to-school physicals and encouraging schools to host vaccination pop-up events. As the Pfizer and Moderna shots currently in use make their way to full FDA approval, which is in many ways a formality since they've already passed testing and safety studies to get to an emergency use authorization, the shots remain completely unavailable for kids under the age of 12. Trials began in March, and the FDA isn't expecting to start vaccinating those younger kids until late fall at the earliest. Until then, doctors recommend masking and distancing when necessary with kids, washing their hands often, and trying to ensure that those around the child do get the shot.
One of the biggest things we can do is vaccinate. And I know if we can vaccinate the people around our younger children who can't get vaccinated, you're going to kind of put a cocoon around them even more so.
Kids' cases are still usually less severe, but hundreds have died. More are winding up in the hospital, and long-term impacts or spreading the virus to other loved ones are very real threats. Sticking around, it appears, even after summer break ends. Abby Larico, 5 on your side.